All right, and we're back for another episode of Black Life Amplified. It is the virtual town hall series hosted by the African American Leadership Forum, Insight News, the Spokesman-Recorder, Minnesota Community Care, Northpoint Health and Wellness, Children's Minnesota, and Gray Matter. I want to give a very special thank you to our sponsors who make this town hall possible. That includes the Minneapolis Foundation, Northpoint Health and Wellness, and Children's Minnesota. Now, we're going to have a very special show today focused on building Black wealth, infrastructure, and ownership. But if you want additional news updates on things happening in community, I want to encourage you to go check out our community sponsors, news sponsors, which include Insight News and the Spokesman-Recorder. And of course, if you want to visit previous episodes, make sure you visit the African American Leadership Forum Facebook page, as well as our YouTube channel to watch previous episodes of Black Life Amplified. And then be sure that you like, comment, and subscribe so that you don't miss a future episode. So on today's episode of Black Life Amplified, again, we're focused on building Black wealth, what that means, how we define it, what it looks like to get into infrastructure development, into home ownership, residential or commercial. And of course, we're going to talk about all things COVID-19 as it relates to our community. So up first, we have Adriene Thornton, who is a nurse and infection preventionist with Children's Minnesota. Adriene, great to see you.
Good to see you as well. And thank you for having me on the show again.
Thank you for holding down the show while I was gone.
Not a problem.
And I feel like has your title changed?
It has. I actually no longer work in infection prevention. I am now the manager of experience and health equity. So a big shift in what I am doing day to day. I'm still helping the infection prevention team out. So I'm still doing some work in dealing with the COVID pandemic, but my day-to-day focuses on making sure the patient experience at Children's is great and that we are providing equitable health care to all patients.
Well, congratulations, first and foremost. And we super appreciate what you do. The work in infection prevention is incredibly important because we are in a pandemic. But as we know, COVID-19 disproportionately impacts Black and Brown people. And so when we think about health equity, we really need to start thinking about what does it mean to level the playing field so that we can have the same health outcomes as our white counterparts, regardless of our socioeconomic status, race, class, etc. So that being said, I have questions for you.
Okay.
Deeply concerned about COVID right now and what is happening.
As are we all, yes.
The Delta variant was one thing, and I still have questions about that. But now there is this Mu variant. So like what in the Greek alphabet is happening? How and why does it keep evolving like this?
Yeah, so the thing about viruses is that they change and mutate all the time. This is nothing new. And that's why the influenza vaccine changes every year, because we have to change the vaccine to kind of predict what the mutation of the virus will be. And so we're not surprised that there are mutations of the COVID virus. I mean, it's been, it is a type of coronavirus, and coronaviruses have been in the environment and mutating for, decades. So this is not unusual. What makes this one unusual is the impact that it's having across the world. So, with the Delta variant, of course, that for whatever reason is a easier to transmit mutation of the COVID virus. People are getting sicker with this variant. And we don't know why, because again, these viruses mutate fairly quickly. And so for whatever reason, COVID is mutating quicker. And as it mutates, it is becoming more virulent and strong. And so we're just trying to keep up with it and figure out what's going on. And the same thing with the Mu, variant. It is new. Sometimes viruses can mutate and the impact is minimal. People will get sick with it. For instance, with influenza, it mutates every year. But for the most part, you have one or two changes in the virus, up to four, which is why we have 4 different components in the vaccine. You have 2 A components and 2 Bs, and that's to cover the mutation of those different viruses. But COVID is mutating much faster. And every time it mutates, it gets worse. It gets stronger. It makes people sicker. And so we are just trying to figure out, why it does that. Because one of the things you have to do when you're looking at viruses is you want to figure out how does it work, what makes it tick, and how do we stop it. And so we know that the vaccines we have work against COVID virus in general. They're effective against the Delta variant. And so we know that it works. We know how, but when it mutates, we don't know how to stop it from mutating or how to deal with that mutation. So that is the problem with all of these different variants of the COVID virus, is that it's just very different from other viruses in the quickness that it mutates and the strength that it gains and the virulence that it gains when it mutates.
So we know that the Delta variant, as long as you are vaccinated, you have a good chance of being able to fight it off, even if you were to contract it. But
Right.
what about the mu, though? And how does the mu differ from the Delta?
Well, we're still looking at it. We don't have many cases in the US. Most of them are in other countries such as Colombia and Peru. And so their vaccines are going to be different than the ones we receive in the United States. So until we have, a large number of cases in the United States, we won't know the effectiveness of our vaccines against it. In theory, our vaccines should be effective. And I want to repeat this: the vaccine does not prevent you from getting COVID-19. The vaccine prevents you from getting critically ill and or dying from the virus. And so because we're not seeing it spread quite as quickly in our vaccinated population, that would say to us that our vaccines are effective. But again, we only see a few cases of the mu variant in the United States right now. As we see more cases, that will indicate whether our vaccines are effective against it or not. Most likely they will be. Thus far, our vaccines have been effective against, and there are other variants that have occurred in between Delta and mu. It's just that they weren't as severe, and our vaccines were effective at preventing them from spreading. So it really just depends on how much of that variant we see in the United States.
Got it. Okay. So we have yesterday, for many of our young people, was the first day of school.
Yep.
And our babies are going back in person for the most part. How much pre-COVID normalcy are they going to have during this school year?
I don't know that we'll get back to pre-COVID normalcy anytime soon, to protect the kids, because the majority of them are not vaccinated. Our high schoolers should be vaccinated, but a lot of our middle schoolers and all of our elementary and pre-K kids, none of them are vaccinated. So we still need to be doing what we were doing last year, which is wearing our masks, social distancing, and making sure that we clean our hands frequently. And that's going to be very important for the kids, especially the younger kids, as they go back to school. Mississippi went back to school before we did, and within the first couple of weeks they had several thousand children out ill with COVID that weren't vaccinated. They had several in the thousands of unvaccinated educators that were out ill or in quarantine. And they did have one child die from COVID that they contracted when they went to school. So it is a serious issue, and it is something that parents need to consider. And, it's amazing. Children are resilient, and I honestly think that they are better able to manage this pandemic than a lot of the adults. Once you explain to a child why they have to wear the mask and what it's going to do in terms of protecting them, they tend not to have a problem with wearing the mask. It's the adults that have all of the issues. And so I think if we keep working with our children and explaining to them, this is why you need to wear a mask, is to protect you, it's to protect your friends, and it's going to make sure, that you are not ill and in the hospital with COVID-19.
Okay. Okay. Now, of course, if folks have additional questions, they can go to the Minnesota Department of Health website for more information on where to get the vaccine, where to get tested. I feel like there are fewer places giving tests right now, and I feel like it's really
Yeah,
a rapid test right now.
right. We've kind of closed down, well, the state closed down a lot of the testing sites just because we weren't seeing as many people getting the test done. But there are still large sites where you can go. I recommend the airport to everyone I know. It's easy in and out. You don't have to pay for parking, and you get your results fairly quickly. And so it is one of those mass testing sites. And you don't have to actually go in the airport. They've actually set up the testing clinic in one of the parking ramps, and the signage is there to direct you directly to the testing site. And some clinics are doing testing. So if you have an identified clinic, you can call your clinic and see if they'll do your test for you. And the state does have other sites, smaller sites set up sporadically throughout the state. So if you go to the Minnesota Department of Health website, you can find those locations to get tested and to get vaccinated. There are vaccine locations. You know, the Cub stores are doing vaccines. Some of the Walgreens, there's a couple of Walmarts that are offering vaccines. So there are ample opportunities for people to get tested and to get vaccinated.
Good, good. Okay. Now, speaking of the airport, one of our producers was talking about doing some traveling, because you got to just travel. You was across the world. I want to go on a little trip. I got to wrap some things up at work. I want to hit the airport ASAP. But given the way that the numbers are looking, the fact that we're going into flu season, did I miss my moment? Should I have traveled during the summer, or is it still safe to travel this fall?
You know, that's a loaded question. Travel is always a risk. There's always an inherent risk. Where you're traveling to may or may not put you at higher risk for transmission. But I tell people all the time, if you're going to travel, you have to follow the guidelines. When you're on the plane, wear your mask, clean your hands. When you are going to your location, stay in your pod. We need to stick with our pods. People are moving outside of their pods, and that's the problem. If you stay in your pod, you should be fine. I traveled to Florida this summer, to Miami actually, where during the time when they had really, really high transmission rates. But I wore my mask at all times except when I was in my room or on the beach and I was 6 feet away from people. And thank you, Lord, I was able to travel, and I did not come back with COVID. I have not tested positive for COVID at all this summer. And I've had a couple of trips. I just returned, as you said, from London, and they are a bit stricter over there than we are over here. I mean, you have to register your location with them before you can come in the country. And if you don't register your location before you get to the country, then they put you in an airplane and send you back. Mm-hmm. So they are serious. Mm-hmm. And then you have to get a test on day 2 and day 5 if you are in quarantine. And, they are on top of it. And I got a text telling me that I was in a location where another person in London, somewhere in London, was tested positive for COVID. And I finally realized that it was someone that was staying at my hotel. But I wasn't worried about it because, again, I had my mask on at all times, except when I was outside and 6 feet away from other people. So I tend not to do indoor activities because if the doors aren't open and you don't have that airflow occurring, then that puts you at higher risk. Even if you're outdoors, if there are big crowds, for instance, there was a Luke Bryant concert last week that I really wanted to go to, but there were going to be entirely too many people there. And I knew that I was not going to want to wear my mask the entire time, so I didn't go. So it's the same thing that we've been talking about for the last year and a half. Wear your mask, make sure you socially distance from people that aren't in your pod, and make sure you're doing frequent hand hygiene. And, when I'm on the plane, people laugh at me, but I have masks that have a hole on the side with a Velcro flap. so that I can lift up my flap and put my straw in there so that I don't have to lift my mask to drink. And if I eat on the plane, which I don't eat for short trips, but a long trip to London, I had to, and I didn't remove my mask, I would put my food under my mask because I want to make sure that I am protected. And, I'm vaccinated. So even if I get COVID, I am less likely to get ill from it. But I have a special needs son who is also vaccinated, but his immune system isn't as strong. And so if I am walking around asymptomatically carrying it, the likelihood of him getting it and getting severely ill is higher. So I do everything I do for me and for him and for others around me that I may not even know. I want to protect everyone. So as long as we're doing what we're supposed to be doing and following the guidelines, I think we're safe. But the problem is that people did not follow the guidelines. When the CDC said all people who are vaccinated can remove their mask, everyone removed their mask. People who weren't vaccinated removed their mask. And so the people who are in the hospital, in the critical care, who are dying from the Delta variant are about 95 to 98% of those are unvaccinated. People who are vaccinated are getting COVID-19 and they are getting the Delta variant, but they are just getting mildly ill with it. They're not being hospitalized, they're not in our ICUs, and they are definitely not dying from the Delta variant if they're vaccinated.
Yeah, I actually had a loved one since my time away, had a loved one pass away from COVID who was unvaccinated and, went through the whole thing. First tested negative, actually tested negative twice. The third test was positive, and within days, she went down so hard. She ended up in the ICU, intubated, and then eventually passed away. And so I just want to give this message to people. It's very real. She went to a family function and got sick.
Yeah, it is definitely real. Go back to pod living. You need to stay in your pod. That is, those are the only people you should be around without a mask. And if you don't know if people are vaccinated, you should be asking. Because if they aren't, you need to have them wear a mask when they're around you.
And I think it's important to build a culture of mask wearing and hand hygiene, right? But then also just testing frequently so that I think I've to a point where I realize, and especially for me as a DJ, where I'm in clubs still,
right?
That's where I work, you know, and I have to recognize that within our community, there are going to be people that are resistant to the vaccine no matter what. But I think if we started pushing frequent testing a little bit more, at least then you would know if you were carrying it. People could make an informed decision about whether or not they wanted to be around you. You could make an informed decision on if it's good for you to be leaving the house. So we all got to work hard.
What people need to know about testing is a test result is only good for that day.
Yeah.
So if you test negative today, that doesn't necessarily mean you're negative tomorrow. You could test positive tomorrow. And we've seen it happen. People will test negative, and boom, they're positive. And so that's because the virus is still building up, its virulence in your system, it's spreading in your system, and it has to get to a level where it's detectable. So you could be carrying it and it not be detectable on a test, but you're still carrying it and possibly passing it on to others. So I don't want people to get super comfortable with a negative test. If you're symptomatic and you have a negative test, then you definitely should be retested within a few days.
Yes, absolutely. Well, thank you, Adriene, for your time and for everything that you do. Please stick around because I want to ask you some questions about Black wealth as well.
Okay.
But we're going to move on to the next part of our show, which is about building Black wealth. So first, I want to find out what are the keys to Black wealth? How do we do it and how do we define it? So panelists, if you could producers, if you could bring the rest of our panelists on, we could move forward with the next segment of our show. So please join me in welcoming good. We do have everyone here. So we have Kenya McKnight, who is the Executive Director for the Black Women's Wealth Alliance, Kimberly Spates, who is the Chief Operating Officer for Northpoint Health and Wellness, and Vachel Hudson, who is the President of the Urban League Young Professionals. So welcome, panelists, to Black Life Amplified, and good morning. Thank you so much for being here.
Good morning. Thanks for the invite.
Of course, of course. Now, I want to start by asking each of you. So, Kimberly, I'll start with you. What do you define Black wealth to be? How do you define Black wealth?
Yeah, thank you again for the opportunity to be here. I'm excited to be here this morning. And to me, Black wealth is the ability to be able to manage both your health and well being, as well as your income and dollars that you have, or any type of other wealth, property, or other type of stocks. But you manage them in a way that not only you're able to live comfortably, but your generations after you are able to live comfortably.
Absolutely. Kenya, I want to ask you the same thing. How do you define Black wealth?
I think the ability to live peacefully and to comfortably, based on your vision, of course, and through generations, of course, and really without real struggle of choice, right? It's very much rooted in choice, your ability to make and resource your choices to support the life you want for yourself, your future, and your family.
Definitely, that choice part is huge. And it's so interesting how, as you begin to accumulate more wealth, you have access just to more options, whether it's healthcare or the schools you attend or, every part of our life. And we're going to talk about the intersection of wealth and health in just a little bit. But I also want to pivot to Vachel. Hey, Vachel, I know you're driving. If you're able to take yourself off mute, I do want to ask you, how do you define Black wealth?
Yeah, so I want to just piggyback off what the others have already said. But in addition to that, just a matter of starting with that foundation. I believe that a lot of times when we hear about wealth, we think it's outside of our grasps. So how do we start thinking about the foundation of wealth and how we can begin building Black wealth, whether it be, again, for our individual selves, families, or community. So just not to go too deep into it, because I know we're talking.
We lost Vachel. So when he comes back, we'll allow him to finish answering. But he brought up a really good point about how we don't always feel like we can, have Black wealth. And for so many of us who are on that pathway to building it for ourselves, we may be the first ones in our family to do it. And that's really scary. So we're going to talk about mindset shifting in a little bit, but I just want to continue level setting the conversation and allowing for our audience to get to know our panelists and how they're doing the work to expand businesses within our community and to grow their own businesses. I want to ask Kenya, can you tell us a little bit about the Black Women's Wealth Alliance? What is it that you all do?
Yeah, thank you. So we are a for-profit company, public benefit corporation in Minnesota. First Black women-owned public benefit corporation. We provide 4 levels of service, wealth education through our nomics series, which includes Queennomics, Emeraldnomics, Familynomics, and we're developing Kingnomics. That is foundational to teaching Black people about the history of Black economics in this country, wealth building 101, personal and collective financial trauma, and wealth mindset tools, budgeting, savings, retirement planning, the whole gamut. It's a 5-week course. We provide technical support to businesses, helping them navigate the entrepreneurial system, understanding where and how to gauge resources. We are actually just getting ready to launch our business fellowship program next week, which we're excited about. And we also provide professional development through our Ms. CEO series. And finally, some direct financial assistance through granting directly to businesses, which most folks know us a lot for. And we're developing a loan fund that will finance Black women entrepreneurs.
So everything that you said, I want to be a part of. How do people sign up? What are the qualifications for being a recipient or participant in the education tools or the resources that you all provide?
Yeah, thank you for that. A lot. That's been the thing. Like, how do we get in touch with them? We've taken a hiatus this year to work on our internal structure as we've really grown a lot. Our new website launches next week as well, which for now, you can go to our website, www.bwwa-us.com, and just sign up for our newsletter and pay attention to our social media. We'll post that. The signing up of our new schedule for all of those different trainings and programs I mentioned will be cleared through our new website, which launches on the 17th of September. So that will be your sign up date. We are offering membership this time around. So you can actually join and become a member and get access to all of who we are and what we do.
That's incredibly exciting. So September 17th is the date. We'll put it on our calendars, make sure we follow up. And we'll also have our producers put the link down in the comments so that people can save it in their browsers and, set up their Google Cal reminder so that they can go and sign up to be a member. So I want to ask Kimberly now, you are the COO of Northpointe. Can you tell us a little bit about what that means and why you do the work that you do?
Yeah, so as the Chief Operations Officer for Northpoint Health and Wellness Center, Inc., my role is to bridge the gap between the public and private parts of our federally qualified healthcare center. And so we work in partnership with Hennepin County and our community board to really provide human and social services to our community. Northpointe has been here for over 50 years and was originally Pilot City. And we focus on providing basic needs and hoping to build education, knowledge for individuals to build them and move them towards self-sufficiency. And so our biggest portfolio of work is our food shelf, which sees over 14,000 people every year. And we provide access to healthcare through our Measure enrollment navigation services, as well as SNAP and other public programs. But we also focus on trying to help individuals understand their own potential and finding jobs or linking them to other things that they might need. And housing has become a really big issue for us. And so we're in the space to not only provide direct service, but also advocate on behalf of the communities that we serve to state, local, even national and federal officials to help guide and direct policies that are often put on our communities, and they have to figure out how to navigate. And so we try to stand in that gap. And then you asked me the question about why I do it. I'm a transplant here from Texas, and my family, we've always been in the space of helping others, teachers, ministers, all those things. And so being in a space to be able to serve individuals that look like me, have had some of the same or similar experiences is part of the DNA, and the values of the organization match my own values. So I'm excited to be moving into my 7th, almost 8th year here at Northpointe, and we've seen substantial growth in our ability to provide services to the community.
And speaking of substantial growth, can you tell us about some of those expansion projects that you've been doing? How did you go from providing the services? People mainly know Northpointe as a clinic, right? Or they are known for, you all are known for the food shelf and for providing resources to the community. Y'all are building stuff and owning buildings, and helping other folks on the north side do the same. So tell us about how that works.
Yeah, so our mission is really around partnering to create a healthier community. And so we are always working to partner with others. And so the particular building that I'm in today, 1256 Penn, Northpointe Inc. has some ownership in this building as we move to expand our campus where our clinic currently is. For those who are Northsiders, they know about Pilot City, and the building that the human services staff were in was demolished. And as part of that movement, we were able to because we own that building. We were able to purchase this space that we're in that also has a nice conference center that we used to do our COVID clinics because we had to pivot and because of COVID. And then as a part of this total project, which has a $87 million plus investment from Hennepin County, we were able to work with our partners at Estes because we needed some of their property. So they have their new chapel. We've expanded in this building, but we'll also be expanding on our footprint where our current building is, the clinic, to build one nice building where all of us will be housed so we can continue to focus on providing our whole person integrated care model that aligns and brings together both health with our clinic, medical, dental, behavioral health, optometry, pharmacy, as well as our human services. So we're really excited. We broke ground a couple of weeks ago, and we'll be moving forward with the beautiful development that's environmentally and energy conscious, and will include a lot of individuals from our own community working on the project. So we're excited about moving forward and being all in one location.
I love it, and congratulations. That's a
Thank you.
huge deal. When you're thinking about, okay, we need a new building, or we might, part of SD's property. What are you looking for? What are the things that are need to be on your checklist in order for you to really proceed and to do so in a way that's going to allow Northpointe to be sustained?
Yeah, so during this process, we really had to bring partners to the table to make this happen. You're talking about a really heavy lift as far as development costs are concerned. And having Hennepin County make the type of investment that they made in North Minneapolis is one of the biggest that has been made in this community for a long time. It was well deserved. The community had been asking for it, and now it's come to fruition almost 10, 20 years later. We also had support from the city because the city, these two lots that we're on right now, where Estes is and where 1256 Penn is, they were both vacant and have been vacant for a long time. And the community had been asking, what are you going to do? And so bringing the community voice to the table, bringing development dollars from both the city and the state, I'm sorry, not the state, from the county, to build this is really what's important. But I think the biggest thing for us has always been the community has been the focus. And so ensuring that the community got what they needed. Estes Funeral Chapel has been in our community for over 60 plus years, and they have provided a service to our community that we can't get anywhere else. And having them at the table during this process has been very helpful to them. Their business has begun to flourish and prosper. For us as a nonprofit, just the ability to have a space that really is owned by the community, because that's really what it is. We have a community board that's made up of 51% of patients of Northpointe. And so as Kenya was previously one of our board members and helped to shepherd this project through with her leadership. And so the focus is really the community and building the community's resilience and ownership, and really feeling like this is a place where the community can come and see themselves in every aspect of the building. We're really excited about that part. We're adding some new pieces to really be able to provide services that folks need, like a drop-in childcare center. A lot of times you got one sick kid, one well kid, you got to bring them both. So now you have a place to drop them off. We're building a wellness center. We used to be able to do Zumba and line dancing and all those things that folks like to do, but COVID kind of shut that down, and our conference room space is not really conducive to that. So building an actual space that's actually for yoga and things like that people can access, because we know hypertension, diabetes, obesity is a large part of our experience as people of color. So having a place to be able to exercise and feel comfortable in your own skin doing that, we're excited about that. And then our bistro, the ability to be able to use some local vendors, hopefully, to build a social enterprise for our young people, as well as anyone who wants to be trained in the food service business. And then we also get to expand our food shelf, which I think people are really going to like to be able to be in a space where they can have choice in what they pick for their foods and see the ethnic foods and culturally appropriate options for folks. So those are some big areas, as well as some new wellness areas, a spiritual healing space that hopefully everyone, all of the folks that come to us will see themselves in. So we're excited about those. So our checklist is really community first, then bringing other partners to the table to leverage our community assets. That was a long-winded answer. I'm sorry.
Oh, I love it because you're doing a lot. That's just what happens when you making big moves. And I love that. And I think what's really important about what you said, one, putting community first, because you're a federally qualified health center. You are a nonprofit. You're based in the heart of North Minneapolis. You've got this long history geographically within the north side of where Pilot City was. All of those things are incredibly important, right? You're creating and expanding a business that meets the needs of the community, and that's led by community. So once the thing is there, you're going to have people to support it. You're going to have people to walk through the doors and to be able to teach those wellness classes and to do all of the things that you've mentioned. But I think another important piece that you mentioned is, in order to get there, it wasn't that Northpointe needed to have 81 million in the bank. You went and sought out resources from different government entities to help fund it. And I think that's a really important part of this conversation when we talk about what it is, what it looks like to build wealth within an existing legacy institution or within a new business that you're building. It's not all, I mean, you do need to have some money in the bank. That is important. Let's be clear. But when you're going and expanding and you're purchasing property or you're developing, it's not about, I need to have every resource in the bank. It's where can I go to find the resources to support it. Can you talk about that more? Because you also are expanding and doing very similar work.
Yes, and if I could just say, I'm so happy. I'm such a Northpointe lover, and what I also know is true about that work is that what was important is that the ownership, right? So because the board is 51% patients, means it also is community owned and controlled, right? The community has more say in what happened, with Northpointe beyond any systems that it's connected to. But having two Black women executive leaders, Stella Whitney West being the CEO, and Kimberly, I think I was there when you were coming on. And so leading the vision, the charge for this, because Northpointe has been after this for a long time, but it has taken these two women to help push it and build it in a different way with the support, of course, of the community as they're carrying that vision. So that's fundamental in whatever you're doing to build wealth. It starts with vision first, understanding what you want, what are you after, what do you need to get there, and what are you willing to do to make it happen? Because you've got to put in the work. Sweat equity is important, and you may not have the money, but you still got to have a vision and put in the work to help get to where you want to be. Partnership absolutely is important. So I just purchased the 1200 West Broadway building, which is known as the Zara. That is actually a health and wellness facility that will focus on Black women entrepreneurs in that industry. We're talking about your spas. We're talking about your acupuncturists, your massage therapists. I think that wellness in our community has to expand beyond clinical care. It's a great component, but at the end of the day, we're going to spend money in Northeast, everywhere to go get all these high level services that we're paying for, but yet we don't have the infrastructure in our community to support us actually being served there. So my job is to help build in that market. And we have a growing base of business owners who are providing those services to provide cultural wellness and healing to our community. So yes, it has taken resources. My project, my acquisition of it was supported by Sunrise Bank. The city of Minneapolis gave us $500,000. Sunrise Bank gave us nearly $800,000, and Fortis Capital $250,000 towards acquiring the building. And I had to put up some of my own money for sure, and most of all, invest in my own personal self and the company, the Black Women's Wealth Alliance, so that we were positioned to be successful in acquiring the property. In that, we have plans, as I talked about expansion, And we were just recently earmarked for $4 million of new market tax credits from Sunrise Bank towards our development. So we're excited about that journey, but collaboration, partnership is key, because none of us come to the table with all the pieces, and our ability to build relationships and connect with people who are smarter than us in the areas that we need is key. I had about six women and men, but women working with me. We spent 9 hours closing on the day of that, of closing, and you got all these women just working, and everybody's doing different pieces. I could not have done all that by myself, and I didn't. It took a whole team, from legal to the city to the bank, to the title company, all these different pieces that made closing work. And throughout this whole process, it's gonna take a lot of other people along the way. So if you are not a person who can share power and space and respect and build with others, and learn and work and share and build together, then you can't do development in the community. But it takes all of those components. And yeah. Sorry, that's.
It's really exciting to hear what both of you are doing. And I think what's really fascinating is your approach is very different. Northpointe being a federally qualified health center and a nonprofit, and the Black Women's Wealth Alliance being you are a certified, what is the term again? Because you're the only one.
Public benefit corporation.
Public benefit corporation. And this is your baby. This is your brainchild. So you created this. So how do you go from, I have this vision, right, of I want to create this hub to help Black women build wealth, and I want to acquire properties on the north side and to normalize wellness and to provide space for it, to be an incubator. How do you go from that to being positioned to receive $4 million in tax credits, to have Sunrise Bank want to give you $800,000? What does it look like to get positioned as a Black person who was an entrepreneur?
Yeah, I mean, you got to look at leaders like Stella Whitney West, Deanna Cummings, Shauna Smith Baker. There's there's a whole gamut of Black women who are fierce leaders, who've put in a lot of work out here. Your Dorothy Bridgeses. And you got to say, well, I got to do something, if, they're all leading in this way, that's so inspirational. But I think, Brittany, even I was a tenant in this building for 3 years before purchasing it, and actually moved out last March because I just couldn't keep up with the rent. And I had decided to prioritize other things in the company. And so I hadn't imagined coming back a year to be the owner. I'm grateful for it because I know of, my heart and focus on community, who the beneficiaries will be. What it looks like is you got to stay true and faithful to the work. And, I did feel like I was done, and I was tired, overwhelmed, and tired of doing the direct work and not having the resources, but trusting the process, and staying focused on the bigger picture, and staying open. Staying open to what the Creator has for you. Sometimes we're focused on the thing we want to do, and we don't realize that, it may be greater than what you're imagining. And in this case, it was. And what it looked like for me personally was that the resources that I got in the door to help, with, some of the work for the Black Women's Wealth Alliance, some of it was for me, as I was a recipient of PPP and, loans and things as a business owner. But what I had to do for sure was make sure I invested in the company's infrastructure, right? Of, systems of legal, HR, admin, financial, et cetera, right? And become an employee of the company. I work for the Black Women's Wealth Alliance now. I have 5 other employees now, so we're an employer. But in order to do that, you have to have systems. And now, what the bank is looking for is your documentation. You have to have a cash flow, right? The bottom line is people want to know is how you're going to pay them back. So that was a key factor. personally, it was about getting my own debt and credit under control. So I had to pay off some student loans. I could have left them there, but I needed my debt to be minimum. So I was fortunate enough to pay off at least $60,000 of my student loans. And I understood some things about credit. I, teach, things at the Black Women's Wealth Alliance. So I was able to increase my credit score by 160 points in less than a year, and using tools and strategies that we teach on myself. And so the positioning was my credit, my debt, and my relationships, my vision, and you going back to some relationships and the process and telling people like, hey, this is what I want to see. And I actually met with the vice president of the bank because if I want them to be vested in what I'm interested in, I have to find out what it takes on their end to do it. So I talked to the vice president and asked her, Terry, and said, what does it take for you to do a deal like this? This is my vision. It's what I'm interested in. And she laid it out for me to say, this is what we require. These are our values. These are the things that we care about. This is how we show up and work. And it was my job to bring myself to that standard. So that they couldn't tell me no. And if they did, they had to come up with another reason why. But thankfully, they said yes. And so there was no special favors, but it was about bringing myself to what was required, to meet the threshold so that the investment could happen.
That's really important to find out, like, what is going to be required of me as I enter into this next level of excellence, as I enter into this next level of entrepreneurship or business expansion, knowing what you're going to have to face at the next level and getting prepared before you even get there. One, that's going to make the door open a lot faster, right? That's definitely a key to Black wealth. But also, we have to be honest, as people of color, as Black people specifically, there are a lot of people that don't want to see us in positions of ownership. We are held to a higher standard, and many of us were not taught these tools and skill sets growing up of like, okay, this is how you get your credit under control.
Yeah.
Your debt to income ratio, that matters. I didn't learn that until I actually took a first time home buyers class, and so I think it's so important for us to, one, be in like radical loving acceptance of like, we don't know what we don't know, but
Absolutely.
not being taught those things is not the excuse to not learning them, right?
Absolutely not. And I come to the table with an incredible amount of what I call earned privilege, right? I wasn't taught any of those things either, but I did learn them and taught myself and learned from others along the way. I've worked in community for 20 years. I have my credibility from the work that I've put in, my sweat equity. So, there are some people who can fast track it, and take the elevator. I took the stairs. And so, there's a process to this. So I've put in my work in a lot of ways and built relationships. Relationships is important. But it isn't about what you don't know. It is about what you're willing to learn and the work you're willing to put in to bring yourself to where you need to be. And there are people who are willing to help and support you. They may not look like you. They may not be people you know yet, but your ability to be open to that, to receive it, but also you have to drive your vision. No one's going to drive it for you. And sometimes it changes, and that's okay. But just keep going, learning, growing, and building and developing yourself, making good relationships, and taking care of what you can along the way, for sure.
And taking care of yourself is a big part of it too. Something that we talked about offline before we went live in this broadcast is there has to be a mindset shift, right? Because a lot of us were not taught about wealth building. A lot of us come from a space of survival, and so what does it mean to get out of that survival space and then to start thinking about, multi-million-dollar tax credits and acquisition of commercial property and strategic partnerships that align and all of these things that takes a specific mindset shift. What would you say for each of you? What was the shift? What was the thing that you maybe needed to heal from, or the habit that you needed to break in order for you to make it to this level? Kenya, I'll start with you.
I was trying to shift it to Kimberly or Adrienne.
Sorry.
No, it's okay. Emotional maturity. It was a big thing for me. And I think for me, just my path and not having the knowledge, the skills, the tools, the language, to even understand how to work with people, how to build. I mean, I used to cut up a lot of places in my days. And so having to learn and grow was important for people to be able to see, like, okay, the thorns are coming off, no, but really it was about, just kind of, listen, I'm the matriarch of my family, and so if I fall, there's no bottom, it's just gonna go. So I have to build a pathway for, the nieces and nephews that I have, who deserve a better life. They deserve a life with more options and choices. The younger people that surround me, the folks who, lives were trampled on and, hopeless, that I've grew up around, and somebody's got to do something in the light. So for me, it was about just trying to make a difference in, in the community I grew up in, and shifting my mindset really came from my work with transportation as a Bush Fellow, and being able to see this 20, 50, 100-year planning. And I'm like, we're not ready for that. Wow, this is going to hurt our people. We have no clue, what's in store that these folks are working on. And so I had to kind of get myself to a place where, and figure out, like, how are you going to show up? Like, what is the work you're going to do to help your people be prepared? And what does that look like? And I've stumbled along the way, but I'm here, and it's taking, it has taken a lot of emotional maturity, me working on my own financial skills and knowledge, research, moving beyond just having passion, but actually getting knowledge, building skills, and relationships to help shift my whole self to my next level of who I am, so that I can be able to have greater impact, in the work that I do here in this realm. And so that's what it has taken for me, but to constantly be motivated by our people, our community, and have good values, integrity, and intentions. That's critically important.
I love that. Kimberly, what do you say?
Yeah, I think for me, it was really just owning the fact that I had the knowledge, skills, and abilities to do the work that I really wanted to do. I had been in governmental work for 11 years when I got here, and being one of the only people of color in situations, sometimes you have to dim your light so that other people don't feel, out of place or inadequate. And coming to Northpointe, I don't have to do that. I can show up as my full self, and also allow others to show up like that, because I feel like when you show up as your true self and you're living in what your true purpose is, you can really do impactful work for the community. And like Kenya said, you got to build yourself up to a standard, and then hold and bring others along, right? So that they understand what their standard is, and helping them get there as well. So this experience of being the COO at Northpointe has been something that I always wanted to do. I might not have known exactly what it is, but it was always going to be somewhere where I was going to be helping people and really do what the Lord had sent me to do, right? This job is not, it's an assignment, right? I'm here for a purpose, and it's not, my own. I have a little bit of me in it, but I'm here to do something, and I'm not done. And so until the Lord says I'm done, I'm going to be here doing it. And like Kenya said, though, with integrity, focused on the community, follow through. If I say I'm going to do something, do that. But also trying to get your own, like you said, have your own stuff together. You can't really ask somebody to do something that you're not willing to do yourself. And so I had this conversation with my leadership team last week. If your words and your actions don't align, it's problematic, because now you're going out into community that has already been treated, unfairly for years, and we look like them, and we've been through the same thing, but we don't do what we say we're going to do. And so this work is important. Stella and her leadership, along with our community board, has shown me and given me the energy, to keep going. Because like Kenya said, like we do in this for a long time, and You see stuff and it's like, man, going through this again? Like we had this happen 10 years ago. Why we keep doing the same thing? But you got to stay focused on your vision and the end product, which is you want your community to be as healthy as possible and have the choice, of going to Mayo if they want to go and it's not a problem, right? If they have a choice of buying a home wherever they would like to buy it and it's not a problem, right? There's no covenant in place and there's no redlining. They can go wherever they want, right? And they can show up as their true self and not be swayed by whatever else is going on because they did the work to get to where they wanted to go. So it's been a journey, but I'm thankful and blessed to be where I'm at, and I'm hopeful that the work that we're doing now and in the future will continue to impact the community.
And I'm sure that it will. You said something that's so incredibly important about it being a calling, because I think that's an important part of when you start building generational wealth, for a lot of us, that is stepping outside of what our family has experienced for generations to create something new. Part of that work is spiritual, just as much as it's a mindset shift. It's about really examining self and really thinking, what is my purpose? Why am I here? Why do I have the desire to influence my community in the way that I do? And being able to say, if that desire is on my heart, then it must be meant for me to step into it and not being afraid of it. Right. And then going forth and doing the work to make sure that you're surrounding yourself. I have this mentor, this coach who always says you have to be a vibrational match to that you want to attract. So if I know that I want to start acquiring property, if I know that I want to buy a house, I need to surround myself with homeowners. And if I don't know any homeowners, I need to go on Facebook and go find some. I need to go on YouTube. I need to start listening to podcasts. Part of why I organized the show the way that I did, the first headline was Keys to Black Wealth, which is a podcast that I listen to. That's all about, unlocking the key so that more of us can get into the door and start seeing ourselves as these developers within community, as the people who are going to create economic opportunities for others. It's not just about opening the door, but bringing our people with us. So ladies, I want to thank you and say congratulations for the work that you're doing. It is so necessary, and you're already making space for so many other people to be able to grow and flourish because you're stepping into your power and your passion. So thank you and congratulations.
Thank you. Appreciate
Thank you. And Adriene, I want to close with you. When we think about Black wealth, when we think about ownership, right? Both of these ladies are creating entities and creating space for our wellness to happen. But we're well aware through the social determinants of health that there are some things that prevent us a lot of times from being able to make it to that level, right? So what can we be doing from a health perspective, from a health equity lens, to help us elevate in this way?
Yeah, thanks for asking that, Brittany. People, I think sometimes negate the importance of health. We spend more money on our health than we do on anything else in the world, including housing. And so I like to tell people you have to prioritize your health over everything, because if you don't have good health, you can't go to work. You can't explore new avenues of creating wealth. You can't share your knowledge and your wealth with your family if you are unhealthy and you're not here to do it. And so the first thing is to prioritize your health. Prioritize your health over everything. Do whatever you need to do to make sure that you are healthy and well and you're able to do and take care of your family. And then once you prioritize your health, you'll have the energy and the time to explore all of the different avenues for you to continue to improve in your economic wealth. If you have money set aside for health insurance that you now don't need to spend because you haven't had to go to the doctor as often, you can take that money and invest it in property, or you can put it into a savings account, or there are a myriad of things you can do with the extra money you will have from being healthy. And so people really just need to prioritize their health, cook more, which is hard. I am a testament to that. I realized a long time ago that I needed to eat out much less and cook at home more. you would be amazed at how much better you feel when you cook food at home and when you don't go out to eat, because then you're healthier. And so again, you're eating at home, so you're not spending the money in the restaurants. You're eating at home, so you're healthier, so you're not spending as much money at the doctor's office. Now you have more money in your pocket and in your bank that you can then take and explore ways to invest that to continue the generational wealth. So prioritize your health over everything, and then start exploring what you can do with the extra money that you will have in your pocket from prioritizing your health.
Very well said. And I think it's so important as we think about our health that we don't lose sight of not just our physical health, but our mental and emotional health as well. You know, what is the relationship that you have with money? As you get on your path to acquiring your wealth, do you start sabotaging yourself and doing things that are counterintuitive to your acceleration because you've got a traumatic relationship with money and you're not used to having it, or because you've got survivor's guilt because you're now seeing levels of success and financial freedom that other people around you may not have access to.
Mm-hmm.
You know, I don't think anybody talks about the emotional toll that success has or that building wealth has. And those are very real things. And so, you know, whatever your spiritual wellness practices, if you got a therapist, if you need one, you know, go to Northpointe, you know, do what you need to do to take care of yourself, because it really does play a role, and it really does make an impact in terms of not just getting there, but staying there and sustaining. Something that Kenya put in the chat is that part of your mindset shift is about moving from a place of deficit, moving out of a deficit mindset, essentially. And so we really have to think from a space of abundance, recognizing that this is something that we can do, even if we haven't come from wealth before, and it is accessible to us. But you have to focus on growing your wealth and maintaining your wealth. And that's got to be a lifestyle, you know, so the people around you hopefully are supporting you in that as well. And of course, we're going to support you here at Black Life Amplified. We're going to do another show in 2 weeks talking about what it looks like to continue to build Black wealth. We're going to have another set of panelists on. One of them is actually an owner of a Black-owned bank that's going to be coming to town. And there's just a series of panelists who are going to be able to share more information and resources on how they did it and how you can do it as well. So panelists, again, thank you for your time, and thank you to our audience members for watching. Be sure to watch Black Life Amplified on the African American Leadership Forum Facebook page, as well as our YouTube channel, and then join us back in 2 weeks. So until next time, take care of yourself, and we'll see you soon.